Hello, my name is Christina Oliver. I am a Excelsior nursing student. So I'm going to give a brief description on HIV and AIDS. HIV, human immunodeficiency virus, is a virus that targets the immune system, specifically the CD4 cells or the T cells, which are crucial for fighting infections. If left untreated, HIV reduces the number of these cells, making the body more vulnerable to infections and certain cancers. AIDS, and that stands for Acquired Immunodeficiency Syndrome. It is the final stage of HIV infection where the immune system is severely damaged. And also, opportunistic infections or cancers take advantage of the weakened immune system. So, with my client today, I'm gonna give an educational topic of HIV AIDS, specifically disease progression. So first, acute HIV infection. This stage occurs within 2 to 4 weeks after the virus enters your body. During this time, HIV multiplies rapidly, and the immune system responds by producing HIV antibodies. Some individuals may develop flu-like symptoms. So you could have a fever, sore throat, swollen lymph nodes here. This stage is known as primary or the acute retroviral syndrome. Now, 2, clinical latency stage, also known as chronic HIV infection or asymptomatic HIV infection. So let me break down what all those terms mean. This stage can last for several years. During this period, the virus is still active but reproduces at very low levels. People may not feel sick or experience any symptoms. However, without treatment, the virus continues to damage the immune system. And then the final progression of this disease is AIDS. If your HIV is not treated, it can progress to AIDS in about 10 years. At this stage, the immune system is severely damaged and the body can no longer fight infections and disease effectively. Symptoms may include you'll see a rapid weight loss, recurring fever, extreme fatigue, prolonged swelling of the lymph nodes, what I discussed in the first stage, opportunistic infections or cancers often occur, which can be life-threatening. So now, let's talk about when you should seek care. Understanding when to seek medical care is crucial in managing HIV/AIDS effectively. You should seek care when you immediately after a potential exposure to IV. So what does that mean? A potential exposure to HIV. Unprotected sex, sharing needles. So you will go into the office to discuss post-exposure prophylaxis. if you are experiencing any flu-like symptoms after a potential exposure to HIV. You should seek medical care. Come in for regular checkups to monitor your CD4 cell count and viral load. If you notice symptoms of opportunistic infections, and what are those symptoms? Persistent fever, unusual fatigue, unexplained weight loss, or swollen lymph nodes. If you have trouble adhering or staying to the plan of your medication regime or experience side effects, let your provider know. So now I went over HIV and AIDS. I would like to get feedback from you to see your understanding. In your own words, can you please tell me the different stages of HIV progression? And I will let my client tell me in their own words. And also, we could use simple quizzes or verbal questions to test their knowledge on when to seek medical care. I will also encourage my client to ask any questions and express any concerns they have right now with HIV and AIDS. Also, provide written material or visual aids to reinforce the information. And lastly, schedule follow-up appointment sessions to review and address any additional questions or misconceptions. Thank you.